This is Strictly Business, presented by the Greater Bakersfield Chamber of Commerce. Sponsored in part by the law offices of Young Wooldridge, San Joaquin Community Hospital.
And welcome back to Strictly Business. I'm Nathan Ollie, Manager of Government Affairs at the Greater Bakersfield Chamber of Commerce. And joining us in our Spotlight segment this week, we have Jimmy Phillips, Executive Director of Marketing and Communications with San Joaquin Community Hospital, and Lorenzo Michaels, he's the Director of Quest Imaging, and we're going to talk about the new Quest location, which opened downtown just last week. So thanks for coming in, guys. Appreciate it.
Thanks, Nathan, for having us.
All right, so talk a little bit about this new location. Why is this important both to San Joaquin and to the Bakersfield community as a whole?
Well, I think, going back to 2010, San Joaquin Community Hospital partnered with Quest Imaging, which at the time was an independent outpatient diagnostic imaging facility out on Stockdale Highway.
Okay.
Since then, this will be our third location. We have one up in Shafter and Stockdale, and now downtown. You think about how Bakersfield and Kern County as a whole has grown, and you realize that West Stockdale is quite a ways out there for a lot of people living on the east side and downtown part of the community. So as part of our mission to make sure that people have better access to healthcare,
right,
we want to make sure that it's not only are the services available in the community and the county, but that they're easily accessible for anyone who wants to get to them.
Okay, great. So what sets this downtown Quest location, what sets this apart from others in both in Bakersfield and around the county as a whole?
Well, the technology is very similar between the Stockdale site and the Chester site. However, when we were purchasing the technology for the Chester location, we really had a strong emphasis on cancer detection.
Okay.
And so the modalities that we have there are really keyed towards those types of tests.
Okay.
So we want to make sure that the MRI that we have at Stockdale is excellent. The one that we have on Chester is also state-of-the-art.
Sure.
But it's keyed more, again, towards
So
oncology.
it works well, it ties in with the cancer center and everything else that's there at the campus.
And that's the purpose of having the location downtown, in addition to creating access for people, being able to come to San Joaquin Community Hospital's campus and have everything from diagnosis to cancer treatment to surgery and everything that comes with it all in one place. That's incredibly huge for our community to be able to go to one location for the entire spectrum of care.
Well, that's outstanding. And tying into sort of the cancer treatment options that are available, I understand that there's a breast health center
Yes.
at the facility. So how is this a benefit to some of our female patients?
Well, the breast center it's one of the founding principles of why we built the building the way we did. The technology that we have in there, 3D mammography, is a key part of that, and the breast center is designed to reduce the time between detection and the beginning of treatment. So the mammography equipment that we have there is absolutely amazing to detect cancers that are otherwise not available to be seen. The breast center being so close will let us immediately hand off patients that have been diagnosed to continue their treatment without an opportunity for that cancer to get any bigger and cause any more risk to life.
Okay.
Yeah, there's two buildings there. You have Quest Imaging and the Cancer Center. And I mean, but it really is one breast health program. Lorenzo mentioned the 3D mammography. A Journal of American Medical Association article came out last year that said that 3D mammography is 41% more effective at detecting breast cancer.
Oh,
so
wow. Okay.
we're not talking about, just semantics here. We're talking about the difference between clearly seeing a tumor and not seeing it, and then diagnosing it correctly up front. That allows us to get those people into the treatment portion and have everybody working together, whether it's the physicians on the diagnostic side, the oncologists on the cancer side. Everybody's collaborating together and deciding what the best course of treatment are for these patients in the program. And ultimately, when you have more people working together seamlessly like that, it creates better outcomes for the patient, and that's what it's all about at the end of the day.
Sure. So again, that early detection, which, as we all know, with cancer can sometimes quite literally be the difference between life and death.
Yeah, absolutely. Another side of that is our lung cancer screening program there. We have something called low-dose CT, which essentially is a CT scan set up to do a screening for lung cancer. You may or may not know this, but lung cancer is the most deadly of all cancers. It kills more people than most other cancers combined on a yearly basis. In Kern County, nearly a quarter of our cancer deaths are lung cancer related. This screening test, and the reason for that is because the mortality is so high because there's normally not symptoms until the cancer moves to other parts of the body. So normally lung cancer isn't detected until stage 3, stage 4, when in many cases it's almost too late. So through this tool, we can detect lung cancer, and we have in stage 1, stage 2, and greatly increase. And we're talking about exponentially increasing the survival rates for these patients.
Any other new technologies like that? I know we had a guest on recently that was talking about, I believe it was pancreatic cancer, that there was a new treatment for that as well. Is that was it pancreatic cancer? The TAPS program, I believe it was TARPS. The acronym might fail me, but it was one of the new. Kidney, I believe it was. But
well, pancreatic cancer is problematic for a number of reasons. It's hard to get to. It's hard. It's wrapped all around a bundle of nerves that makes it incredibly painful. But I can tell you that the technology that we have causes physicians in the community to reach out to us and ask us, can we do this or can we do that? There's a doctor's office that from Los Angeles that wants us to do a special test to work with them to do genetic testing, to do targeted treatment towards a particular person's genetic profile of what the cancer they have. So there's a number of things that are out there that we can, not necessarily we don't treat the cancer at Quest, the Cancer Center does, but we work as a great adjunct to provide better diagnostic tools.
Okay.
I mean, all around, what you're really talking about is better images, because that's what diagnostic imaging does. So the clarity of the images and the ability to turn everything around so quickly to make sure that we get clear diagnosis. So whether you're talking about breast cancer, lung cancer, other conditions that aren't cancer related, that's really the core of what this Quest imaging facility is about. Clearer images, faster turnaround times, and that means better diagnosis and saving lives, keeping people healthy.
So who can use this facility? Is this community-wide? Doctors will refer from across the community, across the county? How does this work?
Oh, yes. We have doctors referring from all over this community and from, down south, up through the Fresno, Porterville area. Anybody can use the facility. Insurances, we take almost every insurance. If the insurance will authorize, a lot of HMOs, they require you to go to certain facilities. But if the insurance will authorize you to come to Quest, then by all means, we will see anybody.
And the best thing for patients to do is, as they're having these conversations with their primary care physician about, whether it's getting their yearly mammogram or other screenings that they need to do, let your primary care doctor know that you want to go to Quest Imaging, because our technology is a step above, and they'll absolutely get you over to us, and we'd love to take care of you.
Great. So what does adding this third location do? We talked a little bit about accessibility. What does this do for the hospital as a whole? Is it just another toolkit a tool in your arsenal of cancer detection and things like that?
Well, going back to 2010, I mentioned that earlier when we first acquired Quest Imaging, that was really our first outpatient service line. Prior to that, when you talk about San Joaquin Community Hospital, you're talking about a hospital, right? There on Chester Avenue. Today, 3 Quest Imaging locations, a cancer center, our Adventist Health Physicians Network. We have doctors around the community. We have lab draw stations, home health. You're starting to talk about not just a hospital, but an entire healthcare network where you can come to our facility, our medical records integrate between the hospital and our outpatient service lines, and we can provide comprehensive care for people. And certainly adding this Quest location, in addition to all the benefits mentioned in terms of access and working closely with our Cancer Center program, it just provides another way for our community to, utilize our healthcare services for their comprehensive healthcare needs.
So a little bit bigger picture, is that the trend in healthcare these days is going to a more comprehensive model instead of having maybe a doctor and then a hospital and then a specialist?
Yeah, and this is just kind of juxtaposing on this now, but hospitals used to be kind of the center of healthcare, but there certainly is an increased effort to keep people well, to educate them on preventative healthcare. We're doing free community lectures every month to try to keep people out of the hospital. Imaging certainly plays a vital role in terms of being a part of that. So yeah, absolutely. There's an effort to provide an entire continuum of care, everything from the primary care to the outpatient setting for radiology and imaging, acute care for cancer and heart attacks and strokes. Yeah, it's the whole spectrum, and we really need to work together, not only with all of our service lines, but our other partners in the community to make sure that Bakersfield and Kern County has the entire healthcare delivery system that it deserves to have for a community of this size.
Just to echo that, along those lines, as a patient, what you wind up having is, if you go to the lab draw station, if you go to imaging, if you go to do some of these things, and God forbid you do wind up having to go to the hospital, all of those records are there for the primary, for the ER doc or whomever is there. They don't have to make calls to get records in. You don't have to worry about any of that stuff. It's all part of the one record. So as far as the patient's experience goes, they're able to get that treatment faster and figure out what's wrong earlier, and that's the key. So the outcomes for the patient is tremendously better for them.
I would certainly imagine that, with the advances in technology and stuff, and having everything in one central location is very, very beneficial. And also, not having to drive. I mean, you're not having to go to down south. You're not having to go down south. I mean, I know that in other parts of the county, you're very limited. You're going to have to go to Bakersfield.
Yeah, that's right.
And now for the folks in Bakersfield, you're not making the trip down the hill and going to LA to see specialists.
I mean, you just think back to 2007. There was not a certified stroke center in Bakersfield. Mm-hmm. It's incredible that 10 years later, 8 years later, we have 4 certified stroke centers. San Joaquin led that effort, and now we can provide, the best care for strokes here in Kern County. There's no reason for the size of Bakersfield that it is for people not to be able to have 99% of their healthcare needs done right here in their hometown. So that's why we built the Cancer Center in the first place. That's why we've partnered with Quest Imaging and continue to expand that service. We've gone up to Shafter. It's all part of making sure people can have high quality healthcare right here in Bakersfield.
Right.
A lot of folks think that going down to places in Santa Barbara or whatnot, that's where you need to go get your imaging. But there is no finer MRI equipment anywhere south of San Francisco to LA, to north of LA, than what we have right here on Chester, right down the road from us. So very proud to say that we have delivered to the community some of the best imaging equipment in California. So that is not hyperbole, that is just fact. Right. And the community, I think, is going to have a tremendous benefit from that.
Well, great developments. It's good, first with the Cancer Center, and now again with the partnership with Quest. It's great benefit for our community. So Jimmy Phillips, Lorenzo Michaels, thanks very much for joining us. And we'll be back right after this with more Strictly Business.
If your doctor